Respected audience, this is Naushab A. Khan, Advocate High Court, Adjunct Faculty Law. In our first and second session, we have discussed that on the eve of International Mental Illness Day, what measures we can take to improve the healthcare dispensation for those who are suffering with this mental ailment and sickness. In our today's session, I'd like to add further aspects to this discussion. As I have stated earlier, and I intend to reiterate, that there are less than 500 psychiatrists in Pakistan who are meant to provide services or render medical services to 240 million population. So there is a gigantic difference between the need and the availability of qualified professionals. And here comes those quacks who are neither qualified nor professionals, and they in the garb of spiritual healing or in the garb of medication, they start misleading the people and make their ailments bad to worse. A recent example of this situation has been reported, and I'd like to share with my audience, that there is no psychiatric consultation, and those who are quacks, unqualified, they are providing the services in inverted commas. Our case study was recently reported from Mardan on the Ministry of Planning's mental health portal. The case described a 65-year-old man who had developed depressive symptoms after a spinal surgery in 1994. This 65-year-old male was, by a quack, prescribed a medicine, and that was an addictive sleeping tablet. Without any proper consultation by a professional, this 65-year-old man started taking tablets for sleep disorder. And in the year 2004, he had a relapse of this symptom, this time after a prostate surgery. He consulted a psychiatrist who got to know that for last many years, the self-subscribed medicine which had been taken by this 65-year-old male was of fatal consequences that has ruined the health of this man, and it was neither required nor prescribed by the professional. So this is the state of affairs, unfortunately, we are facing, and there is a desperate need that we should cultivate professionals, we should improve infrastructure to make ourselves the nation which is concerned for the well-being of its masses. Thank you for the patient hearing.